Somewhere right now, a person with rheumatoid arthritis is standing in their kitchen holding two nearly identical orange bottles, one prescription, one a supplement, quietly wondering if the yellow spice in their pantry might actually be doing something close to what the medication does. Here is the strange part. In 2026, actual clinical trials have started asking that exact question seriously, and the answer is more nuanced and more useful than either the skeptics or the wellness industry usually admit. By the end of this video, you will know what turmeric, omega-3s, and elimination diets can genuinely do for chronic pain and autoimmune conditions, and just as importantly, what they cannot. Quick ask. If this kind of honest, evidence-based health breakdown is useful to you, hit like, subscribe, and drop a comment telling me if you manage chronic pain or an autoimmune condition and what you have actually tried. It genuinely shapes what I dig into next. Now let's get into it. The fire you cannot see. Before we get to the pantry and the supplement aisle, we need to understand what inflammation actually is happening inside a body in chronic pain, because it is not the same event as a sprained ankle swelling up for a week. Acute inflammation is your immune system doing its job well, rushing to an injury, cleaning it up, then standing down once the work is done. Chronic inflammation is different and far quieter. It is your immune system staying activated long after the original threat has passed, sometimes for years, sometimes attacking your own tissue by mistake, which is essentially what happens in autoimmune conditions like rheumatoid arthritis. Picture it as a smoke alarm that never resets, quietly beeping in the background of every joint, every meal, every morning stiffness that makes getting out of bed feel like negotiating with your own body. This matters because it reframes the entire conversation around diet and pain. You are not trying to fix a single injury with food. You are trying to influence a smoldering, long-running immune process one meal at a time. That is a slower, less dramatic story than the wellness industry usually tells, and it happens to be the honest one. Turmeric, separating the spice from the science. Let's start with the ingredient everyone has heard of, and almost nobody understands correctly. Here is the myth worth killing immediately. Sprinkling turmeric powder on your rice is not the same intervention being studied in these clinical trials, and this distinction matters enormously. The active compound researchers are actually testing is curcumin, and your body absorbs almost none of it in its raw form. That is not a minor footnote. It is the central complication running through decades of turmeric research. Now here is where 2026 gets genuinely interesting. A network meta-analysis published in mid-2025 pooling 17 randomized controlled trials found that turmeric preparations significantly reduced pain and improved function in people with knee osteoarthritis compared to placebo, and bioavailability enhanced formulations, meaning curcumin specially processed to actually get absorbed, met the threshold researchers consider clinically meaningful, not just statistically interesting. A separate 2025 trial pushed further, testing curcumin directly alongside a comparator group already taking standard anti-inflammatory medication, and found the combination produced a 70% reduction in reported pain compared to the medication alone. For autoimmune conditions specifically, the picture gets even more textured. Research on rheumatoid arthritis patients found twice-daily curcumin doses significantly outperformed placebo across every measure tracked, reducing disease activity and lowering both inflammation markers and rheumatoid factor levels, a specific antibody linked to the disease itself. Some researchers believe curcumin may help restore balance between two types of immune cells, one that drives inflammation and one that helps regulate it, an imbalance believed to sit underneath conditions like lupus and rheumatoid arthritis. So here is the honest verdict. Turmeric, the spice, sprinkled casually into cooking, is a pleasant, healthy habit, but it is not the intervention the research is actually validating. Curcumin, in a properly absorbed, adequately dosed form, has real, repeated clinical evidence behind it for both osteoarthritis and select autoimmune conditions. This is general information, not personalized medical advice, and curcumin can interact with blood thinners and certain medications. So this is worth a conversation with a doctor before adding a concentrated supplement, especially at higher doses. Omega-3s, the fat your body is quietly starving for. Now let's talk about a category of fat most people know is good for their heart, but rarely connect to their joints, their migraines, or their autoimmune symptoms. Here is the mechanism, and it is worth understanding rather than just memorizing. Omega-3 fatty acids, found in fatty fish and fish oil supplements, compete directly with omega-6 fatty acids, the kind overwhelmingly dominant in a typical Western diet full of vegetable oils and processed foods, for the same metabolic pathways in your body. Omega-6 metabolism tends to produce more inflammatory signaling molecules. Omega-3 metabolism tends to produce the opposite, molecules that actively help resolve inflammation rather than fuel it. Most modern diets have quietly tilted this ratio heavily toward the inflammatory side without anyone deciding to do that on purpose. The clinical evidence backing this up has gotten remarkably specific in the last couple of years. A 2024 network meta-analysis covering 40 randomized controlled trials and over 6,000 participants found high-dose EPA and DHA supplementation, the two primary active compounds in fish oil, produced the largest reduction in migraine frequency and severity among every preventive treatment studied, an unexpected category for something usually marketed around joint health. A 2025 trial went further, giving chronic migraine patients 2 grams daily of EPA specifically, and found a significant reduction in both migraine days and attack frequency. For rheumatoid arthritis specifically, earlier research found something practically useful. People who ate fish more than twice a week showed significantly lower disease activity scores compared to those eating it once a month, with each additional weekly serving associated with a measurable further reduction. Current evidence-based guidance in 2026 generally points toward 1 to 3 grams of combined EPA and DHA daily for meaningfully lowering inflammatory markers like CRP and IL-6, with noticeable changes in blood work often appearing within a matter of weeks, though real symptom relief, the kind you actually feel in your joints, tends to take several months of consistent use. This is general information, not medical advice, and anyone on blood-thinning medication or with a bleeding disorder should talk to a doctor before beginning a high-dose regimen. Elimination diets, where curiosity meets real discipline. Now we arrive at the most demanding and most personal piece of this puzzle: elimination diets, and specifically the version researchers call the Autoimmune Protocol, or AIP. Here is the concept in plain terms. Certain foods, common allergens, nightshades, grains, dairy, are temporarily removed entirely for a period of weeks, then very deliberately reintroduced one at a time, watching closely for any flare in symptoms. It is not a diet in the casual sense. It is closer to a personal experiment, run on your own body with your own data. A 2026 pilot feasibility study tested exactly this approach in adults with rheumatoid arthritis, having participants follow their normal diet for 4 weeks, then transition into an 8-week AIP protocol, tracking patient-reported symptoms and disease impact throughout. This was explicitly described by the researchers as a feasibility study, meaning the primary question was whether people could actually follow it in real life, not simply whether it worked in a tightly controlled lab setting, which matters because a diet that produces incredible results only under laboratory supervision is not much use to someone managing symptoms at their actual kitchen table. Here is the honest nuance sitting underneath all of this. Broader research reviewing dietary strategies in rheumatoid arthritis, including elimination approaches alongside Mediterranean-style patterns, has consistently found that diets rich in fiber, polyphenol, and unsaturated fats improve pain, function, and inflammatory markers in most trials, while diets heavy in refined carbohydrates, added sugars, and ultra-processed foods correlate with higher disease activity. The elimination diet piece specifically is less about one single magic exclusion and more about the disciplined act of noticing, systematically, which specific foods your particular body reacts to, since that answer genuinely differs from person to person in ways a general guideline cannot predict for you individually. This is exactly why elimination diets should not be attempted casually or indefinitely. Removing entire food groups long-term without guidance risks real nutritional gaps, and this approach works best with a doctor or registered dietitian involved, particularly for anyone managing a diagnosed autoimmune condition. This is general information, not a personalized medical recommendation. Bringing it all together. So here is where all 3 pieces land, once the noise gets cleared away. Curcumin, in a properly absorbed form, has real, repeated clinical trial evidence for reducing pain in osteoarthritis and easing symptoms in select autoimmune conditions, but the plain spice on your shelf is not delivering that same dose. Omega-3s have genuine, measurable anti-inflammatory effects, backed by large-scale trials spanning everything from arthritis to migraines, working through a clear, well-understood biological mechanism your Western diet has likely tilted against by default. And elimination diets, done carefully and temporarily rather than as a permanent restriction, offer something none of the supplements can: a genuinely personalized answer about your own specific triggers, at the cost of real discipline and, ideally, professional guidance along the way. None of these are a cure sitting quietly in a bottle or a produce aisle. What the evidence actually supports is something less dramatic and more durable, a pattern of eating that consistently leans your body's chemistry away from that smoldering, chronic fire, meal after meal, month after month, alongside whatever medical care you and your doctor have already built together, not instead of it. If this helped you see your own plate a little differently, subscribe, because we are going to keep pulling apart the health claims everyone repeats but almost nobody actually explains properly. I will see you in the next one.